What are the typical treatment outcomes for astrocytoma? Imagine sitting in a doctor's office, hearing the word astrocytoma, and wondering what the future might hold. The truth is, treatment outcomes for astrocytoma can vary quite a bit depending on the tumor's type, how aggressive it is, and the treatment approach. Astrocytomas are classified into different grades based on how abnormal the cells look under a microscope. The lower grades tend to grow more slowly, while the higher grades are more aggressive. For example, the slow-growing tumor called pilocytic astrocytoma, which is a grade 1 tumor, often responds very well to surgery alone. Many patients with this type can be cured with complete removal of the tumor, and the 5-year survival rate is very high, often close to 90 to 100%. This means most people live at least 5 years after diagnosis, especially with successful surgery. For grade 2 tumors, known as low-grade astrocytomas, the outlook is a bit more variable. These tumors tend to grow slowly but can sometimes progress to higher grades over time. The median survival for these patients is around 8 years, but this can be longer or shorter depending on factors like tumor location and molecular features. The 5-year survival rate for low-grade astrocytomas can range from about 30 to 80%. Achieving a good surgical removal helps improve outcomes, but because these tumors infiltrate surrounding brain tissue, complete removal isn't always possible. Higher-grade tumors, such as anaplastic astrocytomas, are more aggressive. Patients with these tumors often face a median survival of about 3 to 5 years. The 5-year survival rate for these tumors is generally between 20 and 45%. Despite treatment, these tumors tend to recur and progress more quickly. Treatment usually involves a combination of surgery, radiation therapy, and chemotherapy to try to slow tumor growth and extend survival. The most aggressive form, glioblastoma multiforme, has a very challenging outlook. The median survival for patients with glioblastoma is around 15 months, and the 5-year survival rate is less than 10%. Even with the most aggressive treatments, long-term survival remains rare. However, advances in treatment options continue to improve quality of life and survival times for some patients. The extent of surgical removal plays a big role in outcomes. When surgeons can remove most or all of the visible tumor, patients tend to do better. Complete removal is often difficult because these tumors infiltrate brain tissue, but removing as much as possible, usually around 80 to 95%, can significantly improve prognosis. Adjuvant therapies like radiation and chemotherapy also make a difference. Combining these treatments has been shown to extend survival, especially in high-grade astrocytomas. For example, patients with high-grade tumors who receive both radiation and chemotherapy can live longer than those who receive only radiation. Patient factors matter too. Younger patients and those with good functional status, meaning fewer neurological symptoms, often have better outcomes. They tend to respond better to treatment and live longer. In summary, the outlook for astrocytoma depends heavily on the tumor's grade and how much of it can be removed surgically. Low-grade tumors often have favorable outcomes with surgery, while higher-grade tumors requiring a combination of treatments and generally have a poorer prognosis. Personalized treatment plans, early diagnosis, and ongoing monitoring are essential to improve survival and quality of life. Always consult with healthcare professionals for guidance tailored to individual circumstances.